Okay, today's exercise of the month is the bridge. And the bridge is an exercise that works the hips extensors, which are the glutes, the glute max, and the hamstring. And these muscles can be helpful for helping with knee pain, back pain, and of course, hip pain. Okay, so here we go. So I have this box here, and the reason I have this box is because I like, most people when they do a bridge, they have their feet kind of even on the floor with their body, okay? And I like having my feet a little bit higher than your body, maybe 4 to 5 inches higher. And the reason for that is because a lot of people have tight hip flexors, which are these muscles in front of your thigh. And when you have tight hip flexors, that can get in the way and interfere with your ability to do the bridge. The other thing is having your feet a little bit higher, that extra height, the extra range of motion, I think helps people feel their glutes and their hamstrings kind of activate a little bit better. So that's what this box is for. The second thing about the bridge is you really want to make sure that when you're doing the bridge, you press down through your feet to do the work, right? Versus just kind of lifting with your back. So it's supposed to be a glute exercise, a hamstring exercise. So you want to make sure that you're pressing down through your feet to bring everything up versus just literally lifting your back up. And the final thing is you can kind of accentuate whether or not you're working. I mean, when you do a bridge, we're going to work both the glutes and the hamstrings, but you can kind of bias one muscle group more than the other. And generally speaking, if you have the box a little bit further away from you and you do the bridge, that'll be more hamstring, right? And then if you bring the box a little bit closer to you, where there's more of a knee bend, then generally speaking, that'll be more glutes. So that's how you can bias the bridge if you want to work more your glutes and versus your hamstrings. But generally speaking, you'll probably work both at the same time. Okay, so here we go. Okay, so I got my feet higher than my trunk, 4 to 5 inches higher. I'm gonna go ahead and focus on pushing down through my feet versus lifting my back up. So my hands are at my side. I'm gonna push down through my feet, and that'll work your glutes and your hamstrings. And then the same thing, to bridge up, you're gonna push down through your feet to lift up. I'm gonna bias my hamstrings more by moving the box a little bit further out. And then when I do this, you'll feel more hamstring activation, or it'll be harder for your hamstring. And then if I bring the box further in, I can get the glutes probably a little bit better, okay? Don't overextend, so you don't wanna overextend where you're doing like an arch in your back. Okay, at most you wanna come up to like a pretty neutral position, which I can't tell if I am in right now because I can't see myself, but just as long as you don't really overextend. Okay? Okay, that's it.